Candidates for political office say they love universal health care. They brag about how their plan will expand coverage, while their opponent claims that it will leave people uninsured. They talk about the importance of choice in the system, while stressing that everyone deserves health care. Of course, they don't appear to agree on anything, so what does universal health care even mean? Universal health care means that whatever system provides health care to everyone at an affordable price. If everyone can receive preventative and medically necessary treatment without going into debt, the system provides universal health care. Most people agree that more people getting health care is good, but obviously they have different approaches. A public choice theorist would argue that the free market is the best way to achieve universal health care. With no government to get in the way, the invisible hand will find a way to give everyone the treatment they need at a price affordable to them. This, of course, is baloney. Not only does this argument have no real-world support, it is theoretically unsound. The free market, by definition, excludes people who can't afford a product or service. Exclusivity and universality are antonyms for a reason. A liberal would argue that the government should step in to solve this dilemma. Universal health care has positive externalities, so the government needs to spend money to reap those externalities. In the United States, programs like Medicare and Medicaid pool tax dollars to provide insurance to seniors, the most expensive patients, and the poor, the least able to pay. Unfortunately, this system has broken down over time. The government slashed workers' rights, which reduced the number of people covered by their workplace, and then they cut welfare, which left more poor people without insurance. Enter the individual mandate. Switzerland uses this system. This plan requires every adult to purchase health insurance. The logic goes that the more people who pay into insurance, the cheaper it will be for everyone. The government would then provide a subsidy to ensure everyone can buy. The Affordable Care Act used this plan. Based on a proposal by the Heritage Foundation, the ACA required everyone to buy health insurance, but let people buy on a regulated marketplace if they couldn't afford regular insurance. While millions more received health insurance, the ACA did not achieve universal health care. What worked for the small, rich Switzerland utterly failed in the United States. The United States pays the most for healthcare in the developed world by a wide margin and has little to show for it. In France, citizens enjoy a public option, which is basically a government-run health insurance corporation that competes with all the other insurance companies in the free market. Some candidates call this Medicare for all who want it. France has a pretty good healthcare system, but they also kneecap private insurers with strict regulations and give massive subsidies for the public plan. Everyone except the very wealthy use the public option. The US, on the other hand, would introduce a public option to a public mostly using private insurance. Candidates have explicitly expressed their concern for running private plans out of business. This weakens the public option's potential. Still, if we establish a public option using a French model, we should expect a better healthcare system. Norway has a single-payer healthcare system. This takes France's model and removes the option. Every person is covered by a single government insurance plan, with private insurance only for cosmetic or optional care. Bernie Sanders' Medicare for All essentially uses this model. Norway has seen great success with its single-payer system. They enjoy some of the best health outcomes in the entire world. The plan leaves private hospitals, doctors, and manufacturers in the equation. The government essentially pays all their bills using taxpayer money. This leaves a single-payer plan vulnerable to corruption down the line if corporations write sweet deals for themselves. Despite this risk, the results don't lie. A single-payer healthcare system would certainly help the United States. Perhaps we can do better? England has the National Health Service. Every hospital is government-owned, and doctors are government employees. No mainstream candidate has proposed an NHS-style system in the United States, but such a system would be massively preferable to our current ACA train wreck. The NHS has weathered decades of austerity and attempted privatization. Even Margaret Thatcher couldn't bring it down. Openly proposing cuts to the NHS is political suicide, even among conservatives. Such staying power is crucial for any universal healthcare system, but politicians still propose dismantling it in private. The NHS leaves some private institutions in place, and the right propaganda campaign, coupled with a large conservative majority, could finally beat it. British politicians have already begun to loudly whisper their plans for its demise. We can do better. Consider Cuba. Every manufacturer and hospital is owned by the government. Every medical worker is a government employee. Wait, isn't Cuba a disgusting communist backwater? Surely we shouldn't follow their healthcare advice. Not so fast. Despite being a poor island nation with few natural resources under constant embargo, Cuba has healthcare outcomes similar to the United States. The USA's average is heavily swung by its massive inequality. We can have the best of the best and the worst of the worst in the developed world, sometimes only a county away. Cuba vastly outperforms its nation's wealth and geopolitical disadvantage to rival the most powerful and technologically advanced economy on Earth. Cuba has extensively contributed to medical research and has phenomenal healthcare equity. If a poor island nation can rival the USA, imagine what the USA could accomplish with the same system. Don't listen to politicians' weasel words and non-answers. They will call anything socialist, but never provide details on why socialism is bad. They champion choice, but they mean capitalist choice, which is merely privilege with good PR. They complain about the government taking away healthcare, ignoring how private institutions want nothing more than to increase exclusivity. They repeatedly ask, how are you going to pay for it, while Cuba spends a fraction of what we do for similar results. Instead, examine universal healthcare by its outcomes. Look for results around the world. Who has the best metrics? Which system has the most longevity? Where are people most satisfied with their care? What country makes every dollar count? The United States has an overly expensive and massively unequal healthcare system, and capitalists have no intention to fix that.